I'm Dr. Morris, and I just wanted to give you a quick summary for Module 2. First off, I'd really like to commend the group for your excellent work applying Lewin's or the Lean system approach for implementing a proposed practice change. I really enjoyed reading your discussions and seeing the high level of critical thinking that you all demonstrated in those discussions. I was truly impressed with just the overall level of discussion in the modules, and I think that because of the world that we're living in at the moment, the group really had some phenomenal ideas about some practice changes that they would like to see implemented that could really help address some of the problems that we're facing in our healthcare system. And so kudos on an incredibly well done job. Some of the topics that your classmates discussed, several individuals discussed changes to processes for determining when and how to isolate patients. Of course, incredibly timely topic. Many of you talked about changes related to ensuring that you have the necessary equipment available at the bedside to do your jobs, and how you could go about making changes that could help make that happen for you. Some other colleagues really talked about ways that they could adjust how their organization utilizes standing orders to better help ensure that patients' needs are met in a timelier manner. All of these proposed changes really demonstrated a very effective application of the two change theories that we were looking at this past week. And so again, great job for doing that. Some of you might be wondering, what are the next steps if you were actually going to go and implement? So for example, if you were using Lewin's change theory, one of the next steps would really be for you to start thinking about what are the driving forces that would promote the change and what would be the restraining forces. And then what your goal is you want to, of course, optimize those driving forces, because those are the things that are going to help move your change forward, and that you want to try to limit the effects of those restraining forces. Let's see here. In general, in summary, I should say, either of these change theories will work wonderfully. Determining which change theory you use, it's going to depend on a number of different factors. So sometimes it's just your individual preference, which change theory appeals to you most. But I would say you should also include in that determination what the organizational culture looks like at your particular organization, and that may guide you as to which change theory may be preferred for this given situation. And then the other is really looking at your individual practice setting as well. So those would be some of the factors that you would use to determine which change theory might be most appropriate. The other thing I would say to consider is the actual proposed practice change. Which theory you select may be different depending on the nature of the proposed practice change. So now this week you all are already working on Module 3, and we're discussing the concepts of problem solving and knowledge management. Both of these concepts are essential to being an innovator. And so, of course, innovators use their problem solving skills to help determine or develop new solutions to manage today's problems. And of course, innovators can use knowledge management both as a tool to help justify why the innovation is important, as well as to evaluate the effectiveness of the innovation. So anyhow, great work. Keep up the good job. I am so impressed with each and every one of you. Please know that we're here. If you have any questions for us, please reach out to us, and keep on doing a great job. Thank you so much.